Let's go live to Canberra now. Joining me is the Finance Minister Simon Birmingham. Minister, good to see you as always. The government promised all aged care residents and staff would be vaccinated by March this year. It's now June. Why weren't aged care workers prioritised?
Look, 100% of aged care facilities in Victoria have had a vaccine rollout through them, and more than 99% right across the country. There's just a handful with very specific exemptions for or exceptions for different reasons. Now, we would have liked that to have occurred earlier, but of course at that stage we were expecting that the more than 3.5 million doses that were due to turn up from Europe at the start of this year would have arrived. Those contracts weren't honoured, they didn't turn up, we didn't get those vaccines. We of course had built the schedule around the expectation that all Australians would be able to have the AstraZeneca vaccine. Again, the health advice changed, limits it to over 50s. That has allowed us to continue to push on, particularly with those residents in aged care facilities, and that's what's enabled us to get to the point where essentially 85% of all residents in aged care facilities across Australia have chosen to have that first dose of the COVID-19 vaccine. They've all had the choice in relation to doing so, bar just a handful of sites, and that first dose provides something like an 80%, it's estimated, reduction in the likelihood of getting serious illness or sickness, and after the 12-week wait between doses, the rollout will continue to ensure they receive their second dose.
How many workers haven't been vaccinated?
Look, I don't have a precise figure in relation to that. The priority has obviously been those who are most likely to get seriously sick, ill, or indeed die from COVID-19, which are the residents. They're the older people who face that greatest threat, and so they've been the number one priority. They're also the people for whom we've been able to continue to provide the AstraZeneca vaccine under the health advice that applies in Australia.
But workers were also in the 1A group, which is the highest priority. Now, the Royal Commission stated it was a failure on moral grounds not to have all workers vaccinated. So do you accept that the government has failed on this front?
Well, as I say, we will continue to roll out the vaccine. The priority, though, has been to make sure that the vaccine goes to those at greatest risk of death or serious illness. Now, that's older Australians, and particularly those who might be frail, old, or have comorbidities in nursing home and aged care facilities. So the priority firmly, squarely with those residents. Had a younger workforce been able to have AstraZeneca, well then more probably would have been, definitely would have been able to be vaccinated at the same time as those residents. But because the workforce requires, in many cases, the Pfizer vaccine, it has required a different approach in relation to them, and particularly for the workforce to be accessing other distribution channels too.
Do you accept the rule banning staff from working at several federally run facilities shouldn't have been lifted?
No, not necessarily. At a time when we had no COVID transmission in the community, we know that aged care facilities face workforce shortages, and so the ability of workers to be able to meet those shortages is important to the quality of care that residents ultimately receive. However, of course, as soon as problems became apparent in Victoria again, that ban becomes a very important factor when there is potential transmission in the community to prevent that transmission from spreading any faster.
So you'll lift the ban again once things settle down?
We'll work through these issues on the health advice and with the aged care sector. Our priority is making sure that residents are vaccinated and have that choice of being vaccinated, which we have achieved across facilities across the country, but also on making sure that they receive the highest possible quality of care in those facilities too.
Sounds like the ban might be lifted again.
As I say, they're matters to work through in relation to on the health advice with the aged care sector overall. It's not a decision that I, as the Finance Minister, am going to preempt.
Should there be a no jab, no work policy?
Again, that is one for health officials. The health officials across the country had not advised and not recommended that there be a mandatory approach in relation to the aged care workforce. If they change that recommendation, that it be mandated, well then of course we'll work with the states and territories to implement that. But again, understanding what the point of the vaccine is, first and foremost, it is to stop people from getting sick, particularly to stop those who are most vulnerable to severe illness, to potential death from COVID-19 from facing those consequences. And that is all about the older Australian cohort first and foremost. Now, that's why we prioritised aged care facilities. It's why we also prioritise first and foremost those over 70. We've expanded that to over 50s. It's been about addressing those likely to face the most severe consequences of COVID first. And we've got to 100% of aged care residences in Victoria, and around 85% of residents in those facilities have chosen to have that first dose, which does provide a much higher level of protection for them than was faced, of course, last year during the outbreak in Victoria.
Will you be providing extra financial help to Victorian businesses involved in this shutdown?
We'll continue to monitor the situation closely. For businesses, there continues to be the measures such as the loss carryback that we extended in the budget, part of more than $40 billion of additional COVID-19 support and responses we put into the budget handed down only a couple of weeks ago, including that additional support for businesses. For workers, particularly those facing requirements to isolate, pandemic leave payment arrangements remain in place for people to be able to access those payments. Overall, we've provided to Victoria something like $45 billion of
They do need extra help, though,
economic support.
And the state government support.
And we welcome the fact that the state government has, for this short-term lockdown, put in place a $250 million support package for business. Now, this is the third localised lockdown that has occurred since JobKeeper came to an end. We haven't rolled out dramatic additional approaches in relation to those others because targeted state approaches are appropriate for shorter-term lockdowns. If this becomes a more extended matter, well then, of course, we'll look at the changed circumstances.
Okay.